reality orientation for individuals with dementia. This video will cover the topic of reality orientation and the many benefits it yields for dementia patients and those caring for them. A summary of reality orientation. Reality orientation therapy began in 1966 as a rehabilitation therapy for elderly people with dementia. It is a widely used cognitive enhancement technique with varying aspects of care. The method behind reality orientation involves presenting continuous orientation and memory information related to time, place, and person. This helps individuals to gain a greater understanding of their identity and their surroundings. An example of how a nurse or caretaker can conduct a reality orientation session is to start a discussion using the patient's name, talk about the day so far, and discuss the patient's plans for the evening. The care provider should help the patient plan their day according to the patient's personal interests, incorporating social interaction whenever possible. An important component of reality orientation is the way providers go about implementing therapy.
Now that you know a little bit about reorientation therapy, I would like to discuss two of the methods of implementing reorientation therapy. Within the healthcare setting, reality orientation is often carried out in two different ways: 24-hour care, also known as constant care, and reorientation sessions in 1 or 2 hour chunks. In 24-hour care, all staff provide reorientation whenever interacting with the patient. Reorientation can be woven into care in many ways, such as through name use, discussing the patient's interests, daily plans, and reminding them of those plans that they had made for the day, as well as talking about current events. Some of the many ways to improve the quality of 24-hour care are simple: by implementing the use of clocks, calendars, pictures of the patient, and whiteboards so that the nurse and the patient can work together to write out their plan for the day or information about themselves or just topics that come to mind. The other primary method of reality orientation therapy involves sessions, led by a therapist or a trained nurse. These sessions are either one-on-one between the nurse and the patient, or a group of patients led by a therapist with a trained nurse. During these sessions, patients not only interact with the nurse and their assistants, but with one another to reinforce their concepts of self, time, place, and situation. These groups often involve discussions of current events, the seasons, and many other topics that may ground them to the real world and who they are. I know that not everyone out there right now can implement this in a healthcare setting, and many of us are stuck at home taking care of loved ones or family members that suffer from dementia. And some of the adaptations for home use, especially during quarantine, involve 24-hour therapy. Oftentimes, caretakers in the home setting know the patient personally and have a long history with the individual. This may help to strengthen the bond between the patient and the care provider, while also providing an additional reminder of who and where they are. Within the home setting, especially during quarantine, it may be beneficial to utilize 24-hour reorientation due to an increase in the amount of time that can be spent with the individual. Keeping a consistent schedule may also help, and taking time to discuss the individual's relationship to the care provider as well as current events may help to ground them to reality and slow the degradation of their cognitive function. While there is no cure for dementia, reality orientation has many benefits for both those suffering from dementia and those who care for them. Recent research conducted about reality orientation has provided a positive outlook on this therapy's continued use. Typical treatment regimens for dementia include reality orientation along with pharmacological intervention, rarely just one or the other.
Research has been performed on reality orientation therapy to analyze its impact on functional impairment related to dementia. According to a study done by Carme Carrion, reality orientation has been proven to slow cognitive impairment in patients with dementia. It is a great complement to methods of treatment such as pharmacological therapy. According to Carlos Camargo, cognitive function is improved by stimulating areas of the brain that are responsible for executive function and attention. Medication regimens generally only provide stabilization, making it effective to combine with reality orientation therapy. Along with slowing functional impairment, reality orientation can give a large boost in morale for both the patient and the caregiver. Reality orientation is a relatively simple intervention to perform, which makes it easy to consistently recreate. It is a straightforward process that can be easily implemented by nurses and caregivers at home. Continuous use of this treatment builds a strong rapport between the caretaker and the individual with dementia. When a caretaker sees the patient successfully reorient, it is an empowering and encouraging feeling for both the care provider and the patient. Through the use of reorientation to name, location, surroundings, and time, patients can become more aware of themselves and their environment, which may lead to improvements in cognitive function.